Hello, everybody. Welcome and thank you for joining us tonight. My name is George, and I'm a member of the Infinity Med Spa family, but I'm not the presenter for tonight. Oof, what a relief. Well, the topic for tonight is about PRP and will be presented by our experts, Melissa and Tanya, who are the NPs here at the Infinity Med Spa. What is a PRP, you may ask? Well, I will let our experts tell you all about it. Please feel free to send us your questions at any time via the Zoom chat, or just simply wait until the end of the presentation to ask your questions live and in person. Thank you again, and enjoy the presentation. Take it away, Melissa.
Hi, everyone. So our objectives tonight are to discuss what is platelet-rich plasma, PRP, what are the components of platelet-rich plasma, the types of PRP therapies, the current PRP therapies offered here at Infinity Med Spa, and our concluding thoughts of everything we've discussed, and any questions you may have.
Hi everyone, this is Tanya. I'm the other nurse practitioner at Infinity Med Spa. So what is platelet-rich plasma? Platelet-rich plasma therapy is a form of regenerative medicine that amplifies the body's own natural growth factors and stem cells to heal itself or to restore volume loss. Platelet-rich plasma is called lots of different things. It can be called autologous platelet plasma or platelet-rich in growth factors, or plasma-rich in growth factors, excuse me. But they're all essentially the same thing. And what it is a concentration of your own body's naive platelets that are suspended in a small amount of your blood plasma. And the way that we obtain it is by drawing your blood, much the same way as when you donate blood or when you get blood drawn. And we spin the blood at varying speeds using a protocol and an FDA-approved centrifuge. And we separate the blood into 3 layers, which are platelet-poor plasma, platelet-rich plasma, and red blood cells. And we'll talk a little bit more about that on the next slide.
So the components of PRP consist of the plasma, the buffy cone, the erythrocytes, as you can see in the photograph and the picture on the left upper corner. The plasma consists of the 55% of the total blood, and the buffy coat, which is the leukocytes and the platelets, is what we really essentially are trying to capture when we do the centrifuge, because that's the portion that we want to inject or apply, depending on the procedure, onto your body. And then the erythrocytes, which are the red blood cells, which are separated within, after it's been centrifuged, just to focus mostly on the platelets and the leukocytes that most of the platelets that we want to use. And then the lower portion of the diagram is, here at Infinity, we use a double spin technique. So once we've centrifuged the blood that we've obtained from you, we separate the PRP layer, the buffy coat, and also the bottom portion, which is the erythrocytes. We centrifuge it a second time to make sure that we're getting the most concentrated portion of platelets that we want to inject into your skin, apply onto your skin, joints, etc. And with that, you get the most, you pretty much get the highest degree of success with your procedure. And then, as you can see in the other pictures, it just displays the breakdown of what a platelet consists of. So as you can see, there's so many components that go into this tiny little particle that goes into, essentially creating that tissue formation and that collagen regrowth, and also that repair that happens when we apply the PRP into the areas of necessity. And the platelets, the photo on the right lower hand corner just breaks down the platelets, the components of the platelets in terms of what each one does based on their growth factor and what they're promoting when they are injected, and in everyday life when they're used in your body as well.
There are lots of different types of PRP therapies. PRP initially became popular in orthopedic surgery and in dental procedures. And there are hundreds and hundreds of peer-reviewed PubMed articles with studies that show the effectiveness of PRP, and that's why it's so widely used by surgeons to heal bone as well as tissue. However, in the last decade, PRP has become more commonly used in cosmetic dermatology, in anti-aging, in hair restoration, and even sexual health and rejuvenation. And that's what we offer here at Infinity, as well as joint repair.
So as Tanya just stated, we offer varying procedures here at Infinity Med Spa. So the current PRP therapies offered are the Vampire Collection, which consists of the Vampire Facial, the Vampire Facelift, the Vampire Breast Lift, the OShot, the P-Shot, joint injections, and hair restoration.
So I'll talk about the Vampire Facial first, which is a procedure that uses platelet-rich plasma to rejuvenate your skin and to give it a healthy and youthful glow, as well as to reduce the appearance of fine lines, wrinkles, scars, and imperfections in the skin tone. And this is a procedure that is done using the technique of microneedling to exfoliate the top layers of the skin. And after that, your platelet-rich plasma is applied topically to penetrate into the deeper layers of the skin to promote maximum collagen production. And the improvement in skin tone and texture can be seen as soon as 1 to 2 days, but maximum effects are usually seen within 2 to 3 weeks as the skin builds new collagen. And it is recommended to repeat this procedure every 8 weeks for best results, and of course to use routine skincare.
The Vampire Faceless is a procedure that involves using Juvederm, which is a product produced by Allergan, who also manufacture Botox. And what happens is Juvederm, which is a hyaluronic acid-based dermal filler, is injected into the skin, the face primarily, and again, we'll discuss other areas it can be injected in as well. But what happens is it restores the shape and color and texture, and along with enhancing the normal shape of the face. And what happens is once we've created that scaffolding of the hyaluronic acid dermal filler, we inject it with the platelet-rich plasma, which helps pretty much enhance the skin's functionality, helping to increase that collagen flow, that tissue repair, that youthfulness and that glow that Tanya previously mentioned when you do the Vampire Facial. And also it just helps getting that bring back that life into your face that that kind of starts to dissipate as you age. Again, this is a procedure that will take usually start to see results within 2 to 3 weeks. Obviously immediately because of the dermal fillers, you'll see it that day. But in terms of tissue growth, et cetera, it'll take about 2 or 3 weeks and then takes full on effect within 2 to 3 months. And this is a procedure that lasts a little longer, up to a year or two, just because, again, we're injecting with the dermal fillers. But as Tanya previously mentioned, it's all about, regular maintenance, using proper skin treatments and skin care products, as we highly recommend here at Skin Medica, and just being very self-conscious, very conscious of what you do on your day-to-day basis.
All right, and next we'll talk about the Vampire Breast Lift, which is a non-surgical form of breast enhancement. Unlike a traditional breast lift or a breast augmentation, which relies on surgical incisions, a Vampire Breast Lift relies on injecting platelet-rich plasma into parts of your cleavage to give it a more youthful, contoured appearance. And the Vampire Breast Lift is also, along with improving the cleavage, it's very good for reducing the appearance of scars or stretch marks that may be seen on the breast, improving nipple sensitivity, and also improving imperfections that are associated with breast augmentation. Sometimes when women get breast augmentation, over time, the breasts, especially in the cleavage area, can start to hollow, and the vampire breast lift is used to enhance the cleavage in that area. And as you can see on this picture on the top right, this is a before and after picture of a client of Dr. Charles Reynolds, who developed this procedure. And this was after 3 months.
And the next thing we can use PRP for is the OShot, which is a non-surgical treatment which increases sexual arousal and rejuvenates the vagina. What happens is injecting this PRP within the clitoral hood, it just helps enhance the areas of sexual response within the vagina. And a lot of people notice the benefits after they've received the OShot in terms of increase in libido, sexual desire, an increase in clitoral and vaginal sensitivity, and also strong, more intense, and more frequent orgasms. But also, it also helps to decrease urinary incontinence, increase in vaginal lubrication that, over time, because of aging, especially when there's a decrease in estrogen in our bodies, women primarily, we notice, these vaginal changes occur as well. So again, this is an injection that, again, will be super helpful for you as a female, and also an enjoyable experience for you and the loved one. And in terms of the effects, some women start to experience it within that first week of getting the injections. But again, this is something that may take up to 2 to 3 weeks to start having that tissue formation, and also up to 3 to 9 weeks to actually notice that full-on effect of it. And this results have been known to last up to a year.
So just like with the OShot for women, we have the P-shot for men. And this is indicated for men experiencing erectile dysfunction, or for men who simply desire a stronger, longer, and firmer erection. And the effects of the P-shot also last for approximately a year, sometimes longer. And the P-shot involves injecting platelet-rich plasma into specific areas of the penile tissue, along the shaft as well as in the head, to promote new blood vessel formation and increase circulation. And within 2 to 3 months, this procedure stimulates increased blood flow to the penis, as well as increased sensitivity to the head. And just like with most of our PRP therapies, specifically with the P-shot, it is most effective when used in combination with other procedures like hormone replacement and peptide therapy, which we also offer here.
And if there wasn't enough things you can do with PRP, we also offer joint injections, which is a therapy that uses the platelet-rich plasma injected into the patient's area of concern, such as if they have an injured tendon, ligaments, muscles, joints. And what happens is we're using your own blood and centrifuge down to inject into the problem areas to help, again, regenerate that tissue, repair that tissue, and help with pain relieving factors as well. And this, again, this is something that people usually start to feel relief within that, the first few days or even that week. And also, again, as the tissue forms within the course of the 2 or 3 weeks, again, you feel you have an increase in functionality, and also a decrease in the pain felt, if any, at the time. And again, this is something that you'll notice over a course of, an average between 6 to 9 months, where you'll see maximum effect of the PRP within the area of concern that was injected. But again, these effects can last, beyond a year or so. And it's just something that's really awesome, especially if you're suffering with osteoarthritis or you're an athlete and you had recent, injury areas, et cetera, and you're just, you're kind of trying to do something different aside from corticosteroids, that's much more safer, healthier, and natural, this is definitely an option that you should definitely consider.
All right, and next we'll talk about hair restoration. So platelet-rich plasma is really great for hair loss, and this is done in a 3-step process where the person's blood is drawn and processed, and then it is injected into the scalp. The PRP injections trigger natural hair growth and maintain it by increasing the blood flow supply to the hair follicles, and over time increasing the thickness of the hair shaft. This approach is often combined with other hair loss procedures, which could be in the form of supplements, shampoos, hormone replacement, and the PRP therapy requires 3 treatments 4 to 6 weeks apart for maximum results, with maintenance treatments every 4 to 6 months.
And again, sky's the limit with PRP. So this was just a few of the procedures we have. I'm sure there'll be many more in the future to come. So again, just keep us in mind. And again, PRP is something that is revolutionary. It's something that's up and coming, and it's definitely something that you should consider to be used on anywhere you desire.
So we just want to thank you all for taking the time to watch this webinar and to listen to us. And please do not hesitate to reach out to us for more information at infinitymedicalspa.com. And you can also follow us on Facebook and Instagram, or give us a call. And now we just want to open up the floor to any questions.
Okay. Thank you, ladies. I actually have some questions in here that they were sent in, if I may read them to you. The first one is, what are there any side effects or complications?
So there are, the biggest side effects of any PRP injection is bruising and tenderness in the area of injection. And this is usually only lasts for 2 to 3 days. And the bruising and tenderness is actually a sign of inflammation and that the procedure worked. Because what we're doing is, injecting this very rich platelet concentration into this area to cause an inflammation, to cause those growth factors and stem cells to come to that area and rejuvenate it and heal it. So really the biggest side effect is just a little bit of tenderness. Other than that, there are no risks of the procedure. It's your own blood. It's injected safely by, Melissa and I, who have gone through the training. And really there's no part of the body that it can't be injected into, perhaps short of the eyeball.
Okay. Next question. Can PRP be combined with any other treatments?
As mentioned throughout this presentation, PRP can be definitely combined with the other procedures that we offer here at Infinity Med Spa, such as bioidentical hormones and also peptide therapies. Because what happens is, in combination, just like as Tanya mentioned with the P-shot and as well as the O-shot, it just enhances the experience and the sensations felt, and also gives us overall just this overall complete well-being in terms of the body within and out, when everything is all in alignment and at its optimal performance. And again, that's something that we would discuss with you on an individual basis in terms of depending on what procedure we're getting and what, whether it be a peptide, whether it be bioidentical hormone or both, or anything else that we have here to offer, that we could definitely throw some PRP on that.
Okay. Next one, how quickly does PRP work?
PRP, depending on the procedure, usually takes about 2 to 3 months for maximum results. You can start to see results sooner, within 1 to 2 weeks for most procedures, but maximum results are usually seen within 2 to 3 months. The exception is with the vampire facial. Those results can usually be seen sometimes as soon as 1 to 2 days. The skin can have a youthful glow, a dewy look to it within 1 to 2 days after the procedure. But within 1 to 2 weeks is when you see maximum collagen production. But for all the other procedures, usually about 2 to 3 months. At the 2-month mark is when we would invite you back for a repeat procedure if you wanted more volume.
Okay, thank you. How many treatments will I need to see any results?
Again, as Tanya just mentioned, each procedure is individualized. So it's based on what you're coming in with and what needs to be done. So again, that's an individual consultation. So, some procedures such as the vampire facial, that's something that you would do, as Tanya mentioned, like with maintenance, depending on if you were coming in for, acne treatments, scarring, things like that. You'd have a series of treatments. Same thing if you were doing hair restoration in terms of coming and getting it done, the earliest, at least every 4 weeks, the injections into your scalp of PRP, as short as, maybe 3 treatments on. But again, everyone's individualized, and that's why we would need you to come in for the consultation, and we'd go over it in terms of what would best suit your situation.
Okay, thank you. What should I do or not do prior to a PRP treatment?
The biggest things that you should do prior to a PRP treatment is to hydrate really well the day before, or maybe even a couple days before, because basically we're drawing your blood. The other thing that one thing you should try not to do is, if you are taking non-steroidal anti-inflammatories like Advil or Motrin, ibuprofen, naproxen, any of those, try to avoid taking it if possible, because non-steroidal anti-inflammatory medications deactivate platelets. So in order for you to get the best results, you should not take them if possible. And you should also not take them after the procedure.
Okay. How can I find out if I'm a good candidate for PRP?
Well, come on down and call us or call us, come and find out, It's one of those things, again, it's an individual basis, but honestly, if you have blood in your body, then yes, you're a candidate, you know what I mean? And you're best be able to, extract it and, use it for its purpose intended in terms of healing and taking care of the body. So honestly, there's no really restrictions actually, unless there's, different, health reasons, et cetera. But again, that's between consultation with you and your provider. But I'm sure that we definitely could find something we can do for you. So again, in terms of finding out if you're a good candidate, yes, you are.
Okay. The next one is a 2-part question. Number 1, are there any restrictions after treatment? And number 2, can I drive, for example, after the treatment?
Sure. So you can, to answer the second question first, you can definitely drive after the procedure. There is no downtime from the procedure. So you can go back to all of your normal activities. You can work out, you can drive, you can go, take a bath, you can do whatever. There's really no downtime. The only thing that you may experience is just a little bit of tenderness in the area of injection, but like I said, that's normal, expected result, and that usually goes away within 2 to 3 days.
And just to piggyback on what Tanya was saying, the only one that would say would probably be the joint injections, only because depending on where it's injected, you want to kind of limit the activity you put on that, at least for a week or two, just to let the platelets do their job. But again, that's an individualized discussion with each person. But essentially, just like Tanya said, you can pretty much get up and go right after we're done with you here.
Yes, thank you, Melissa, for correcting me for the joints. Yes, there is some activity restriction with joint injections, just because we want to keep the PRP in the joint space in order for it to work well, and we don't want it to diffuse out of the joint space.
Okay. The last question, the PRP procedure and treatment sounds like a miracle. Can you tell me what the cost of this miracle will be?
It's between you and Jesus. But anyway, like, I mean, it's honestly, it's something that it's an individual, because again, in consultation with me or Tanya, it's, it depends on the what you're getting done. And but again, that's something that the prices vary, and we offer a lot of different incentives and programs such as reward points and things like that here. So again, that's something that we would talk to you once that, we sit down, we figure out what it is that you want, because you could be coming in here for one thing, and then we further discuss, and maybe perhaps instead of going for a facial, you want a facelift instead, a vampire facelift, or, as Tanya touched upon, you would like to, explore combining that with the breast lift. So again, prices vary, and again, we'll keep that towards individual speaking with each of you, but you're more than welcome to call in the information provided in the previous slide. And just check us out, and we'll be more than happy to give you that detail.
Great. Okay. Well, thank you, ladies, and thank everybody for being with us tonight. We hope that this has been a useful and educational session. We'd like to remind you that the last Thursday of every month, we're holding similar sessions on various topics. So please keep tuned on these, and we'll be glad to have you again join. Thank you, and have a great night. And above all, please be safe and stay well. Hope to see you soon.
Thank you.
Thank you.